Question number 2, the Honourable Annette King.
My question's to the Minister of Health. Why did he say on the 29th of July that core Crown health expenditure covers, quote, most but not all inflationary pressures, end quote, and why does he deny the shortfall is having an impact on patients?
The Honourable Dr Jonathan Coleman.
Mr Speaker, because the government is delivering 50,000 more elective operations, 60,000 more surgical appointments, 50,000 more medical appointments, faster cancer care, 5,500 more doctors and nurses, and free GP visits and prescriptions for 750,000 children. The big picture is that everyone knows that patients are getting more health services under national stewardship. The real question is, why does the member continue to deny that?
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette
What
King.
was his response to the Rotorua GP who wrote to him this week outlining his horror at the refusal of a specialist appointment for his patient with an enlarged prostate because the specialist couldn't see the patient within the required time limit, something the GP called a schizophrenic approach?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, I read that letter last night and I think the GP may have a bit of a misunderstanding of how the sector works, so I'm writing back to him at the moment to discuss how we can best manage that prostate patient's needs.
Mr Speaker.
Supplementary question, the Honourable Annette King.
Well, if the Minister did read the GP's letter from Rotorua, did he note that the doctor said this was not the only case he had had? It's now happening on a regular basis, and described the situation as very serious and a scandal?
The Honourable Dr Jonathan Coleman.
Yes, I did read those comments. I noted them and I'm writing back to the GP.
Do you agree?
Order.
Supplementary question, Mr
No,
Speaker.
I don't agree, but...
No, sorry, Mr
Supplementary
Speaker.
question.
I'm
I
sure you
don't necessarily
Mr.
agree.
Speaker.
Don't bring me into the debate. The Honourable Annette King, supplementary question.
If there is sufficient funding, why has an 85-year-old man who lives alone and finds household chores very difficult had his home help reduced from 1 hour a week to 1 hour a fortnight to save the DHB money?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, I'm not familiar with that particular case, but if the member would like to forward the details, very happy to look into it. As she said before, it's better to help patients rather than to use them, as she continually does.
Order.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Why, if everything is as good as he claims, has the DHB written to this elderly man saying demand is outgrowing available funding, which means that cuts have to be made, and it looks like it's going to be the old people affected first?
The Honourable Dr Jonathan
Well,
Coleman.
I haven't seen that letter. I doubt those are the words that have been used. But don't forget, this member has been publicly very supportive of health decisions made since the election. So she supported the replacement of HBL, she supported the Commissioner in Southern, she supports free under 13, she supports more surgery, and she's even stated publicly that she thinks that overall we've got a very good health system and that it's working well.
Point of order, Mr Speaker.
Point of order, the Honourable Annette King.
Mr Speaker, I seek leave to table a letter from Mid Central District Health Board dated the 24th of August 2015 saying demand for these services is outgrowing our available funding.
Order. No need to further describe the document. Leave is sought to table that particular letter on the Mid Central DHB. Is there any objection? There is none. It can be tabled. Supplementary question, the Honourable Annette King.
Why should an elderly woman living alone who has multiple disabilities have her home help cut from 1 hour a week to 1 hour a fortnight on the grounds that it will assist people to stay in their own homes longer? Something the woman has called an affront to the elderly.
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, I'm not familiar with that case, but what I do know is back in 2006, Labor took 367 people off home care in Wanganui in one fell swoop, and then they did the same straight again in 2007. So I think that might make the member look a little bit like
Order. The Minister can resume his seat.
Supplementary question, Mr Speaker.
Order.
No, I was talking about you.
Order. Point of order, the Honourable Chester.
Absolutely no way we could hear the answer the Minister gave to that last supplementary question, and I would like I would like to have the House have the benefit of hearing that answer.
Order. No, I need no further assistance. There was a very significant interjection through that point of order. If I could identify that person, I'd be asking that person to leave. I don't need any assistance from Grant Robertson. Order. The question was answered right at the start. The Minister then went on with further answering that did incite a fair reaction from this side. That's not an excuse for the reaction from this side, but that's certainly what did occur. Both sides need to settle down with their answering if there are further supplementary questions. Supplementary question, the Honourable
question,
Annette
Mr.
King.
Speaker. Why does he keep saying there is sufficient funding in DHBs when thousands of letters like this one are sent to patients every week saying DHBs are only able to take limited referrals that are the most urgent?
The Honourable Dr Jonathan Coleman.
Well, look, nothing has changed. For decades, DHBs have had to prioritise the most urgent patients, and we are doing more all the time. So more operations, more appointments, better cancer care. We're actually doing a lot more than that government was doing. So the answer to unmet need is actually to do more, which we are doing. That's a simple answer.
Mr. Speaker.
Point of order, the Honourable
Mr.
Annette
Speaker, I seek leave to table a letter from the Hutt Valley DHB dated the 15th of March 2015, pointing out what I said in my
Order.
question.
Leave us sought to table that particular letter. Was there any objection? There is none. It can be tabled.
Thank you.
Question number 3, Dr Shane Reety.